Desia, she just messaged me that she's still working on getting her audio set up there, but we'll go ahead and get started, and then as soon as she's able to join, she can take over from there. Vina, thank you so much for getting everything set up for today, getting the agenda out to everybody, and making sure that we all have the information that we need. Make sure these continue moving forward. Appreciate that. So our first item is going to be the call to order. So we've got 8:35 call to order, and a review and approval of the agenda. Let me make sure I'm doing this correctly here. Yeah, so if you want to go ahead and review the agenda, and if there's anything that needs to be added or changed, please make note of that. Otherwise, I will accept a motion to approve the agenda for today's meeting.
Is that agenda for today? Because it says September on it, so I just want to double check.
Oh yeah, the one on your screen there is minutes from last meeting. In fact, is it possible to get the?
My apologies, I have the wrong agenda up. Thank you for noting that, Daisy. Give me a second. Let's open that up.
Do you want me to share this my screen here with the one that you sent me?
Sure, Jonathan, if you have that already, that would be great. Thank you.
Great.
Or
Yeah, right there.
actually, I think.
Great. Yeah. There.
Okay, now we're looking at the right thing. Thank you, guys.
So we've got on the agenda there the the approval of the minutes, and then if you want to scroll down a little bit, the officer reports. Following up on previous business, old business with Angie. Our new business, and then roundtable. Any modifications to that agenda? Do I have a motion to approve that agenda?
I Vina, motion to approve the agenda.
And a second?
This is Diane Morey, I second.
Great. So now we go to the approval of the minutes from our last meeting, September 17th. You should have received that via email previously, but looks like Vina also has that out in front of us here for review. So I'm going to take a second, look over those minutes, and then if there's anything that we need to modify on there. Any adjustments to those minutes?
That was cut off at the end, or maybe it's not loading. Oh, there it is. Okay. All right.
Anything that we need to add or adjust in those minutes? If not, I'll accept a motion to approve.
This is Diane Maury. I motion to approve.
Dr. Maury motions to approve. And is there a second?
Jonathan, is this the one with the PPD down below?
What page? What page are you referring to?
I saw it from like yesterday's emails. Yeah, right here.
Mm-hmm.
So change to PPD. I don't think people said that negative quantiferin test could replace two-step TB testing, because like Kaiser, they still want 2 dates. So I think what was recommended was we would keep the two-step TB testing initially, followed by an annual quantiferin level.
So maybe we should adjust that, say negative quantiferin test could replace the follow-up annual.
Yeah.
Okay.
Yes.
Yeah, that's what I remember too, Angie.
Yeah, I was going over it last night very late. I'm like, oh, I think that's wrong. So just wanted to make sure that that's amended. Thank you. And we'll go over that later on in the section. Thanks. Bye.
Thank you, Angie.
Great. Any other edits? Okay. I have a motion from Dr. Maury. If that still stands, Dr. Maury.
With the amendment.
The amendment.
Yeah.
Okay.
Second, Angie.
Angie seconds with the amendment. Okay. All right, so we move on to officer reports, and I'm still watching here. It looks like Desia is trying to connect to audio right now. So as soon as you're on, Desia, if you want to let us know. But officer reports, awards, nominations committee led by Eileen. Eileen, are you on? Let's see, what's my phone number? I think I see the VA phone number on. Yeah, there's Eileen. Eileen, do you have a report for us on awards nominations?
No, we awarded the last meeting, the student. Can you hear me?
Yep.
Okay, yeah, we awarded the last student in the previous meeting. So nothing else to report, but our next application deadline is next year.
Okay. If I remember right, that the recipient, the student recipient, Ivy, is currently working at ARMC in some kind of student nurse role. Kudos to Daisy for getting great students into her organization early. And then that goes to Daisy for a treasurer report.
Good morning. Yes, we're very happy to have her here. That's wonderful news for ARMC. So for the treasurer's report, the balance, can you guys hear me?
Yes.
Okay. For the treasurer's report for October 31st, our balance was $6,833.66. We did have a deposit of $750 for the membership dues. So our current balance as of yesterday was $7,583.66. So we had 5 organizations that did pay the membership fees, and all of that was deposited. So that's good. And what I have pending is I did get a bill for the PO box, which is due at November 30th for $118. So I do need approval to pay that bill. And that's all I have.
Okay. Desia motions to approve that. Do we, I think on that, we do vote on that, so I would have a second.
I'll second.
Okay.
Thank you.
Who was the I?
Jessica Perez.
Jessica. Okay, thank you, Jessica.
And I guess all those in favor and any opposed, if you are opposed to that, you can put that in the chat, please, so that it can be on record and we make sure that we address that. No opposed, motion is passed to approve the $118 paid for the PO box.
And that is also for the whole year. They had a 6-month option, but I thought it'd be easier just to pay the whole year.
Definitely.
And while we're waiting, I did send out massive emails to request that, anyone who wanted to be a member, that they should pay their membership dues. But I did not get any additional payments, and I went on Wednesday to check the PO box.
Which I suppose is a great segue right into, unless there's anything else you want to cover, Daisy, segue into the membership committee. Miracle, let's see, Tracy is on. I'm looking for Miracle as well, but Tracy or Miracle, do you want to give a membership committee report?
Hi, Jonathan. This is Tracy. I haven't been able to connect with Miracle. I know she had the information, so I apologize at this time.
All right, and then I guess that's Tracy, Miracle, and Sana, I think. Is that right?
Yes, that's correct. I don't see Sana in our list of participants, so I'm not sure if she's here today. But just to speak for the group, here is our membership form. It was emailed by Miracle, and it was also emailed by Daisy Hardas, our treasurer. But the deadline was October 15th. But I mean, if you submitted your IEHEC membership, the invoice is on our website. I could also put a link at the end so that you guys have a copy of it. We did send that last time, but you can email Daisy Hardas here. Her email is there, so that for the direct deposit information if you need to. Otherwise, you would mail it to your check, your membership check, and this application to this address here for IEHEC. If you go to our website and you go to members, our invoice application is there as well, and you can click on it and download our, I guess I could just copy this so that you guys have it in the chat box. Give me a minute here, everyone. So I put that link in the chat box so that you can click on the invoice membership application. We'll continue to accept your membership payments and such. As Daisy had stated, we only have 5 paid members, and then we also have our members that are excused, who are also part of our consortium. So I think we had a total of 20 members last term. So we're far behind right now. So if it would be beneficial if you guys are able to join. Remember the cost of all of this, all of our funding, it does go to some of the scholarships and also the awards for our nurse mentors, as well as our students. So we like to showcase all of our award recipients every time. And I know that Eileen already spoke on it, but these were our last 2 recipients last year for the Nurse Mentor Award. And then I believe that was Shane Bigelow, and then Ivy Mai, who's our student from Cal State San Bernardino. But if even in previous years, we always love to give these awards to our students and recognize our nurse mentors. So please, 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 if you haven't already, do become a member. We do have a lot of updates about like BRN, from the BRN, some trends with clinical rotations and placements. And it's just a great outlet for all of these things so that we can communicate and work in partnership with each other between the schools and the clinical facilities. All right, so I think that is that part. All right, I'll give it back to you, Jonathan.
Okay. Yes, yeah, it looks like maybe your audio is on. Is that correct? Am I seeing that right? Maybe, maybe not. Okay, so we'll go ahead and move on to Austin. I see you're on the Zoom call there. Do you have a report for us on Community Information Liaison Committee?
Yes, so for the website, not a bunch of updates, but did get a lot of pictures for our members, so got those all uploaded. I think we're just missing a couple of people. Yeah, so if you go there, yeah, so got most of those updated. Some of the pictures, if they're like really big, I have to shrink them down or crop them, but most of them I was able to keep how they were sent. And then, yeah, so if you guys don't see your picture on there, if you want to email them to me, I can get those uploaded.
Great.
And then, the other thing that I just wanted to bring up, the contact page on the right, notice that this wasn't sending an email to anyone. So I can get that fixed. I just need to know whose email that should get sent to, in case anyone uses that. And I think that was really it.
Yeah, that's great. That's a great question.
I'm wondering if we should send it to Daisy, your treasurer, IHEC treasurer email. Just a suggestion, but great question.
Yeah, that's fine with me if you want to do that. You can add me in there.
Perfect.
Okay.
And that email is here for you, Austin.
Okay.
IHECtreasurer@gmail.com. So we can link that together.
Okay.
And then I also know that Austin has helped us have these links available for our social media. So Facebook, Twitter, Instagram, those links are working as well. So if you want to get those, you guys can click on that as well.
Oh yeah, and I think we're planning on taking this recording of this meeting and posting it on the website too. So that should start after this meeting.
Perfect. Yeah, we are recording this meeting right now, so I'm glad we have that option now, so that's great. And Austin also uploaded this in our community events. This is a Connect for Impact event, so if you have any African-American students that are interested in learning more about how to become a nurse, information is here. It is a Zoom meeting. It will will be November 21st. Oh, wow, that's coming up quick here. So November 21st, 9 to 11, and they'll have information on how to become a nurse, nurse educator, nurse executive, or a critical care nurse. So please share that with your students. Also wanted to showcase, you know, in the middle of this pandemic, we've had lots of flu clinics going on in the fall season, and just wanted to showcase CVU College of Nursing. Dr. Susan Drummond and Dr. Geneva Oakes were able to help out with a flu clinic at Janet Goski. This was a last minute thing, and they brought many students, and they were able to do all the flu shots for all the seniors that drove by at that time. So we just want to recognize them as all of these opportunities are valuable to our students. So, and if you look at everything below, these were from last year. There's information about residency programs from before. So if you haven't checked out our website, there's a lot of things that Austin has posted on there for us, and we're grateful for him. So you can download previous presentations and find out what's going on out in the community. Thanks, Austin.
Yep, thank you.
Great, so that brings us to the Legislative Education and Research Committee, Jessica and Angie.
Hi, this is Jessica. I don't have any new updates. I do want to let everyone know that we'll be discussing with our NEC the EDP 18 forms and what those are and what that need is later on in the meeting.
Right. Angie, I'm thinking that it probably makes sense to just move on to the continue the old business of the forms, since that's kind of along the lines of what I'm guessing you're wanting to talk about.
Okay. Vina, were you able to put those on the, like on as part of the documents for today?
I lost my, give me a minute. Trying to find my mic. Can you guys hear me?
Yes.
Okay, perfect. Yes, which one did you want to start with?
Probably the clinical profile, maybe.
Clinical profile, okay. We'll do that. And we will open this. All right.
Okay.
Are you able to see it?
Yeah. So here's the new clinical profile. We changed the name to Inland Empire Health Education Consortium from the Inland Empire Consortium. And on number 6 down below, we've added what you guys wanted to do in terms of health insurance, immunization, and faculty qualifications and certifications that the school have to maintain. And then just some editorial changes on the body of this form. And then at the very bottom, I think there's like a second page. Okay, so here we took out, you know, the date of birth and the social security, as we've all pretty much agreed that we can't be asking for those information and then sending them over to the facility because, you know, privacy issues and stuff like that. So I think if there's nothing else, I mean, you can let us know if there's any edits that need to be done, but if nothing else, this would be one of the documents that was revised, and we would need to get this pretty much approved and disseminated to all the community partners.
Maybe along those lines, it would be worth maybe scrolling through, Vina, again, slowly through the form so that everybody could read through one last time with the goal of then being able to take a motion to approve this as the new updated version of this form for the consortium. So for everybody on the line, this would probably be a good opportunity to make sure and pause and read through as she's scrolling to make sure that we're all on the same page, and if there's any feedback on the form. From Fern, the goal would be today to approve this if it meets with everybody's approval. Can you scroll back up just a little bit, being right there? That's sorry, go ahead, Angie.
There is a second line on the a little bit down below, scroll down, where it says print name of preparer. So there's actually a line there, and I don't know why it's no longer there, but we can definitely put it. So you have a place to print your name and then sign it on the top. There you go. Oops, yeah, it kind of disappears.
Weird. Okay. Yeah, well, there it is.
There you go. Yeah. Okay. So yeah, that's how. And of course, it would give the month and year as November 2020, because these I think these forms were it originated in 2013. It was revised in 2016, and then it was due for another revision. So just an FYI to everybody, all of our bylaws and documents are reviewed and edited, or, you know, if there's no edits, just reviewed at least once every 3 years. So this was actually way overdue.
It seems like if I'm remembering all the edits and conversation in developing those, that this should make things a little bit more streamlined for schools. I think it would be a good thing for schools, and without sacrificing any kind of value or importance for facilities. So it seems like it's a good thing to.
Vina, the word documentation before the signature, that actually needs to carry over to supporting. Yeah, when you do this in Word and then you kind of publish it, it just messes up the formatting and stuff like that, depending on you, if your computer uses a docs format or doc or whatever. I think I would recommend like making a PDF version so that it doesn't lose any of the components and the formatting of the real document, and maybe like a secondary Word document, if that makes sense. Are we ready to call the question?
Yes.
Okay.
Yeah, so we'll take a motion to approve the form.
I move that we approve the revised clinical profile.
And do we have a second?
I put on notes. This is Eileen.
Okay.
What about other programs, like if they can add like NP? Because, we sometimes the facilities gets requests for NP placements or DNP placements.
Can you scroll down to that?
Other,
you have to scroll down.
Yeah, scroll down. Also, where it says I certify just needs to be reformatted. Because this is still the original form that I think.
Yeah, we can probably put other before course.
Yeah, put other, because I know, like when I was doing the coordination before, we get requests for NP placements or DNP.
Good point.
Where it says program, go up. and maybe put other. And then the I certify, okay, yeah, that was
I'm
it.
sorry, where?
Go back down.
This program under instructor name, cell phone program, rotation information right there in that section
Mm-hmm.
where it says program.
Are we putting
DN, ADN, BSN, ELM.
That might be
If you could add
hard.
other.
Vina, if that's hard for you to do right now,
Yeah, you could do it later or.
So you other?
Yes. Just
Yeah, other, like for
There you
NP
go.
placements, because sometimes we get NP placements or DNP placements,
And then, yeah, or just,
or even surgical tech.
you can decrease that course level line so it's not so close. Yeah. Yeah.
And if you could put a line right after other, so then, you know, you guys could write in whatever that is.
Yeah. Yeah. Thanks, Vina.
Mm-hmm. Whoops. We'll make this line shorter. Any other corrections or revisions?
And then just, yeah.
Did you want this like over here?
Yeah.
Okay.
Yeah, that looks good.
Okay.
Thank you.
Anything else?
Is there a
All right.
second?
Can we start back over with the motion then and accept the motion again?
I move that we accept the clinical profile as edited.
I, as Jessica Grez, will second that motion.
Great. Hopefully this will be a nice.
All right.
We have to vote.
We're saving it. Okay. So that one is finished. All right. We're going to share a new document. Which document do you want to look at next?
Do we need to vote on that?
Vote on it.
Oh yeah, I'm sorry. All those in favor of approving that revised clinical profile, say aye or raise your hand or put a yes in the
chat box.
And all those opposed, please say opposed or whatever adjustments you need in the chat box. All yeses and ayes. Motion is carried.
All righty. And then which document do you want up next, Angie?
The explanation, please.
Okay.
All right, thank you. So for the explanation, we just went over all of the recommendations from the CDC and updated all the references and made all the hyperlinks hot. And so you're going to see that every single one of them pretty much have a hyperlink that you can look into if you're needing some rationale or more guidance in terms of what is needed. But most of the timeline for the PPD and all the immunizations were pretty much retrieved from the CDC recommendations. And then also formatting was edited. So that negative right there probably needs that one line, one space needs to be eliminated down below.
Negative where?
On hepatitis B.
Mm-hmm.
Just see how that there's a line on negative.
Oh, okay.
Thank you. And then the history and physical clearance, we added that that a clearance report signed by the provider shall be provided to school on admission to the nursing program and for any interruption in enrollment. So like if the student have a leave of absence and of course withdrawal, I think that's what we talked about last time, that was added on there. And then the seasonal flu student declines refer to the IEHEC student declination of annual influenza vaccination form. Oh, I was so tired. So on that note, it should say note that facilities may decline student placed it's basically may decline any student who does not have a flu shot or a flu vaccine, or who declines flu shot. May decline any students who refuses to obtain a flu vaccine. Because that is true, right? Like Kaiser, if you don't have a flu vaccine for that year, they can't, that's their policy.
Especially this year.
Yeah, so I
And
think,
Corona's gonna adopt that as well for this year.
I'm sorry?
Corona's adopting that as well for this
Okay.
year.
Okay. So yeah, I think that's what we talked about for the most part. You can have them look it up again or review the document.
I have a question. How do the schools indicate that the students have had the flu vaccine? So in the hospitals, usually there's a sticker on your badge or something like that. Is there some sort of visual like identification or way for the schools to know that the students have gotten their flu vaccine? Because I'm thinking about clinical instructors and, how would they know if someone declined or not?
So, so all the schools pretty much are give the information on all the immunizations that the hospitals require to the hospital court, whoever's the designated liaison to the school. All of those informations are given to that, like director of education or the manager of education or the clinical coordinator of the hospital. And so let's say, for instance, student number 9 declines, they will not be given a sticker, or they would not be given placement at all. And so if they're not given a sticker, they have to have their mask on the whole time. And then everyone else, they receive their sticker, and it's on their badge.
Well, masks are required at all times now. So
Right. And that's why I think a lot of, I don't want to say a lot of people, there are some students that would say, well, it's kind of, redundant because I have to wear a mask every time anyway, so they don't get the flu shot if they have allergies or whatever. But it's still, a policy of the facility to say, well, we still require a flu shot, and we won't accept a student that don't have a flu shot.
Yeah, that's how we're handling it at Pomona right now. Both for students and for employees, we've had the same kind of thing where some people have started to go down that path of reasoning of, well, if I'm going to have to wear a mask anyway, do I even bother with the flu shot if they had already second guessed it? So there's a really big push at the hospital here to make sure that all associates receive the flu shot, and we're deep into that process. We've got, I think, a better percentage than we've ever gotten of associates receiving the flu vaccine, which is fantastic. And then for students who come into the hospital, we require them to send in the documentation of the flu shot ahead of time. And then when they come on the first day of their rotation, they're given a flu sticker to put onto their school badge.
Right. And then there are some hospitals who want to see the actual report of the flu shot.
Yes.
So, lot number, etc.
Yes.
So there are some hospitals that will just, we would attest that the student got the flu shot. We looked at the lot numbers, and it's updated for the season. And then we just give the dates to the facility, so there are no identifiers. But let's say, for instance, in other hospitals, the student has to bring their actual document and submit it or present it to the clinical educator, and then that's when they're given the sticker. Do we have any more questions on the explanation for the requirements?
I'd be interested, are there concerns from other schools about the content on here? I'm not saying that because there's any particular reason for concern of it, but I guess just looking through it, does it seem like there's going to be any significant difference in communication to students or anything like that as a result of this? I think it's all stuff that we've been already doing.
Right.
Is that accurate, Angie?
Right. These are things that we're actually doing, and we as a body just look at, you know, CDC recommendations. If it has changed, then we would want to make sure that we follow those guidelines, and that's why we give you know, the URLs or, you know, the hot links to the CDC, so that the students and or facilities and or instructors can have a way to figure out, okay, this is where they got that information, this is what they're doing. And then at the bottom it says facilities may you know, policies may supersede these requirements. So of course, if they I think at one point Kaiser was requiring polio vaccine, so if they still require that, then we would need to ask students for documentation on their polio.
Great. So with that, is there any motion to approve this revised and updated explanation of requirements?
Good morning. This is Dessa. Can you hear me now?
Yes. Awesome.
Oh, hi. I've been having, I apologize to everyone in the committee. I'm having some serious technical problems this morning, but I can hear you. You guys couldn't hear me, but I will motion to approve.
Okay. Motion from Jessia. And a second.
Jonathan?
Yeah.
This is Tracy from West Coast. I have a question just in regards to this form in general. I know it's very specific for students.
Mm-hmm.
This would also be applicable then for the instructor, correct, at the clinical site? So
yes. Yes, that is correct. And actually, Vina, do you have that clinical profile form handy that you could pull that back up and specifically the statement at the bottom of it?
Right. In the clinical profile, it says that it's for instructors.
Sorry, are you, so not the explanation of required health and immunization requirements, you need a different form?
Yeah, if you want to pull up the one we were just on, the clinical profile.
Oh, the previous one. Okay, hold on just a minute.
Okay, and then it's down towards the bottom, right near the signature line. I think the wording is kind of relates exactly to what you're asking, Tracy.
So sorry, hold on.
No problem, I know it's asking this question.
I know which form you're talking about in regards to the clinical profile, and it says students and instructors. Right. I was just speaking on behalf of the last form that you guys were just approving.
I think, yeah, I think
the identifies or specifies students. I was only
Tracy, I think you cut out there.
Yeah, she cut off.
Tracy, I just heard the first part of your statement there. Are you still on? Yeah, if you want to scroll down, Vina, to that statement right there. Yeah, that I certify the students and instructors this rotation meet the following requirements as outlined in the Inland Empire Education Consortium health requirement and non-health requirements. And so that language points to that description of requirements that we're talking about right now with the immunizations and all of those things. So as far as the legal connection between the documents, that statement right there and signature points to the other.
Right. Or even like on, I mean, I don't know if this is overkill, but like if you go scroll up and there where it says immunizations, you can have parentheses as noted or as explained in the IEHEC health requirements explanation or whatever. Down below where it says immunizations.
Right here?
Yeah, we can put up parentheses that says as explained or as noted in the whatever the title of the other document is. IEHEC explanations for immunizations or whatever. You'd have to see the document title.
I think it's IEHEC explanation of requirements.
Yeah.
Tracy, are you still there? The audio dropped out, but I want to make sure that we're addressing.
Yes, my internet got lost, and so then it reconnected me. I'm sorry.
Or maybe instead of explain, because you already have explanation, maybe you could say as described.
Does that kind of address what you're talking about, Tracy, or?
Second document because it's specified students. So I just didn't want it to be ambiguous.
Can you pull that up?
That it's students and not instructors. Does that make sense?
Yes, that's a good point. So Vina, do you want to go back to that other document now and we can see where it says that?
So I'm saving that. We're good with all of that. And then I'm going to open up the other document again. Oh, here it is. Wait, is it sharing? Do you guys see it? No?
Yes.
Yes.
Did you?
Yes.
Did you see it? Okay. Okay, perfect.
Could you, on here, Vina, is there a way to control F?
Yes.
And then just put student?
There's going to be a lot, I'm sure. Is there any?
Okay. Okay, so that's what Tracy's talking about.
Right,
so we have to say, we can find and replace. Do you know how to do that?
Yeah. So
and you just say student/faculty.
Oh, students. So wherever it says student/faculty. Okay.
Yeah.
Hold on. Let's see if I could.
I'm sorry, I just don't want this to be ambiguous and changed into some type of interpretation that if somebody sees this, they see one form that says something, and then we have this form, but it's specific to students and not faculty as well.
No, that totally makes sense.
I'm trying to find my find and replace.
It's on file. And oh.
Yeah, it doesn't. I don't know. Usually it's in the taskbar, but
okay.
I could definitely do it. I mean, for
yeah, okay.
Time.
Yeah. So
yeah, just wherever it says student, it should say student/faculty, correct?
Yeah.
Correct.
Okay. All right.
Okay, so with that revision included, I think we already had a motion on the table from Desia and a second by Tracy. Do we want to re-up that. Desia, do you still have a motion to approve?
Yeah, I still will approve. That looks good with the changes that were made.
And I'll approve as well, Tracy.
Okay, and all those in favor say aye or raise your hand or in the chat box.
Aye.
And any opposed? And motion is carried, and I will happily pass the baton back to Desia.
Okay. Can we pull back up the agenda so I can see where we're at?
Yes.
I'm sorry, I think we have a third.
We have one more. We have one more form. Yeah.
Oh, the flu declination form.
Yeah, so sorry. Anyhow,
That's okay.
last document, flu declination form, was also reviewed and revised, and Jonathan and Miracle and I looked at this and felt that this is more encompassing what we practice now. And so this is, again, did we put the reference at the bottom? So yes, CDC Joint Commission, and also adapted from the CDC Prevention and Control of Influenza with Vaccines.
Okay.
I have questions. Can you scroll down to the reasons for declining? Have already had the flu shot and have provided proof, or where's your option where it says that there's some sort of proof provided? Because why are they declining?
So did you want to just add, have already had the flu shot and documents provided?
Yeah,
Okay.
and provided, proof or some sort of proof.
Is that good?
Can I ask a question about that, though? Why would we have them fill out a flu declination if we already have documentation that they have received a flu vaccine? Is it maybe a timing thing or something? But I guess I need to understand that a little more clearly.
I agree with that. You wouldn't sign a declination if you've already had your flu shot.
Right.
Yeah.
And is it because this was supposed to be used by the schools who are providing the flu shot? That's why we provide the declination, because we are providing it and someone's declining it from us as a facility because whatever reasons, and or they've already received the flu somewhere else.
Do any of the schools provide the flu vaccine for their students?
Yes, sometimes like they would go to like a flu clinic.
Loma Linda has a flu clinic for our students.
So
Okay.
I think where this kind of came up is when students receive flu shots from like flu clinics, and it's not necessarily documented well in terms of like lot number and expiration date and what side of the arm or whatever. And they're not able to provide that documentation, but they can provide like a date, like, oh, I got it from, CVS or whatever, but they didn't give me that lot number.
Then that's not going to be acceptable then.
Right. So in some places it will not be acceptable, but in other places it would be. Does that make sense?
I do understand that, and maybe that is a reason to do this, but I know that when we've had flu clinics on our campus that, were run by LA County or whatever it was in cooperation with our school, we did make sure that the students had their proper documentation if they received the flu shot at that flu clinic, because we were aware of the requirements of the facilities. So that may be something I would think would be handled by the school to make sure that that happens if possible. Again, I may not know something, so I'm certainly open to anyone else saying anything. It just seems odd to have it on here versus maybe some other mechanism. I don't know.
Because I could tell you right now, our infection control will reject that.
Right.
We
some
would either
place.
provide the proof with the proper documentation, or you get another flu shot, or you
get
don't.
their flu shot. And so that's and so the student comes back and tells them, well, my doctor won't give me another flu shot because I already got a flu shot. So that's where, I mean, we can remove it. It's just it's one of the reasons why. So these it's like reasons why student, or not just students, but it's reasons why people decline another flu shot.
So is this a hot topic in a lot of hospitals right now, because we're making it pretty much mandatory and they have to have true reasons to decline. So, I mean, we are, asking for in a way, some sort of proof that this really is the reason, because there are people who, I mean, we've had people come up with bogus religious reason cards that they got off the internet that says, with the same fake pastor that, well, I shouldn't say that, but the same pastor that is all over the internet. So I mean, I just feel for this season, just the way things are, any of these have to have some sort of proof. I don't know how the other hospitals are handling it.
So some hospitals will ask for the lot number. Some hospitals will just ask for the date. So there's variations in hospital requirements. So if a student comes in with let's say a flu shot document from a flu clinic, but they did not get the lot number, they would probably be placed in a hospital that don't require the lot number.
So from what you said, then it sounds like maybe we wouldn't need that statement on here because there is a mechanism, well, at least for your example. So
Right.
just trying to understand
Right.
if there is a
Right.
need.
Yeah, that's why I said we can remove it, but it is one of the reasons that we get from
Sure.
students and instructors.
Mm-hmm.
I got
And
a
I'm
flu
not sure
shot. Yeah, go ahead.
if you're all aware, but there is a vaccine that is not made with eggs as well.
Right. And so, yeah, I don't think it's a matter of whether or not we would approve a declination. They're reasonings that we get from why the students, would decline. And let me give you an example. So we had a student and she basically I get a reaction from this because I'm allergic to eggs. That's what she says. And we said, well, okay, so we're not saying you have to get the vaccine, the flu vaccine. What we're saying is these are not our rules. They are basically, if you want to be placed in this X facility, you need to get it or they will not accept you. So she went ahead and took the vaccine, but she basically filled out this form and said, I'm not going to get it. This is my declination. I'm allergic to eggs. So then we told her, well, we could only go to this hospital for this rotation. And this specific hospitals require that you have or you present a flu vaccine documentation. And so she went ahead and did it. But it didn't prevent her from filling out this document saying that I declined because I have this, right? But she ended up getting it anyways. So I think this document is for documentations and reasons why people decline the flu shots, but not necessarily you know, trying to figure out, well, is that a valid reason or not? Whether or not it's a valid reason, that's their reason for declining. And it's up to the facilities to say, well, that's a bogus, everything is bogus. We want a flu shot. In this day and age, we want a flu shot. And that's what we convey to the instructor and the students. In this day and age, when there is a pandemic, before where you can decline a flu shot, it's probably not the case right now. And people are more mandating that students and instructors get the flu vaccine. And if you don't want to get it, you don't have to get it. But just know that that's their policy, and they will not accept you in that hospital if you do not provide specific documents.
I'm sorry, what did you say? Hello? Hello? Hello?
I'm not exactly sure who that was.
Yeah, I didn't hear anything.
Oh, yeah, I can hear somebody else talking on my end.
Oh.
Yeah, I don't.
It was Eileen.
Oh.
Okay. Eileen. She's always the culprit. I didn't hear her this time, though. Okay, well.
So I just have a question. So there are facilities that if you do not get a flu vaccine, because if you have an allergy, they will not take you, and even if you sign the form, they won't take you in the clinical setting?
That is correct. And that is their policy. That's their policy. That's their hospital. They can make their own policies.
Okay.
So with this declination form, do we want to say a couple of things? One, making this, whoever's signing it, aware that the facilities may, just as you said, may make their own determinations on you must have a flu shot or you may not be able to be there. Secondly, there may be requirements to provide documentation for any of these reasons that may be accepted by a facility.
Right. So that's actually on the other form, and we can be explicit on this form. Okay. What the crazy thing about these three forms is they're actually all together. They're, they're the three forms from the IEHEC consortium, right? And so on the other form that we looked at earlier, it actually says that note that the hospitals could decline student placement of those who refuse or whatever, right? But we can definitely put that here.
It might not be a bad idea because, I mean, they're signing it instead of having to look at the other form, and I understand they're in conjunction, which is great.
Right.
But yeah.
No, I totally agree with you. But yeah, we probably could just put that where is the best place to put that in, I guess is the question. I understand I can change my mind anytime if vaccine is available. I've read and fully understand the declination form.
Maybe right below that.
Maybe, yeah, something along the lines. I understand that the facility has the right to decline my clinical placement. Is somebody writing? I'm sorry. Hold on. I'm just gonna write it. Clinical facility has the right to deny my clinical placement due to lack of a current flu vaccine. And I'm gonna put it on the chat so Vina can have something to work with. I understand that Clinical facility has the right to deny due to lack of a current flu vaccine. There you go.
And then do we also want to say that the facility may require documentation of any of these reasons?
Definitely the facilities.
Angie, are you wanting me to add this onto this document right now?
Yeah, I'm writing the other one. Proof of documents with lot number information and the expiration date. Yeah, I think they said it goes down after the
So just let me know where.
where it says before the signature.
Before the signature, so which part?
Oh, it already says there, the facility holds the right to refuse students who did not obtain an updated seasonal flu vaccine.
Yeah.
Okay, so that we don't have to, but what about documentation of I have an allergy or I've had, you know, other reasons, those kinds of things too? The facility may, it sounded like there was conversation that talked about that.
Oh, okay, so can you go up above Bina, these?
Let me know if you want me to go higher.
So maybe on the allergy to preservative and vaccine, we can just put something about medical, with a medical note or something like that. I'm gonna see. Let me see if I can do it.
With a medical note from provider?
Something like that would
from
with
which?
with a healthcare provider note or something like that. Despite these facts, I'm choosing to decline right now for the following reason. Yeah.
For both the allergies?
Yeah.
Okay, anything else?
Probably for the Guillain-Barré too. Have had I just want to say have had documented Guillain-Barré or other medical conditions. Yeah.
All right.
And then can you get on the chat, what's this, facilities have the right to require actual proof of flu documents?
Mm-hmm. And where do you want that?
Just put it right before students and instructor down at the very bottom. Do you see right here? The other one, the third statement, yeah, right.
Oh, this one?
Yeah, before that. To require control proof of, and then proof of flu documents right here, proof of flu right here. There you go. All right, that should be that should have, I think, everything that people added right now. How does that look? Is it from Diane Murray?
Yeah, that sounds.
Okay. I think I know people's voices, but I don't.
Yeah, no, that was me. You're right.
All right, so that.
Good. Any other additions, revisions?
Okay, should we entertain a motion at this point?
I think so.
Okay.
That's pretty comprehensive.
I motion to approve. This is Diane Maury.
And this is Dessa. I can second.
Okay.
All those in favor?
Aye.
Aye.
I think that concludes my section.
Aye.
Okay. Yes. All right, let's get back.
Motion carried. Actually, before we say that, any opposed? Then motion is carried. Sorry, sorry, Desia. I just
No, go ahead,
facilitated the
Don.
motion there, but I don't know if I was. I didn't mean to step on toes there.
No toes stepped on. Keep going.
Okay, let's new screen share.
Okay. Then
All right, I think we're back on track. The agenda. Thank you, everyone. So, sorry, Dessa, go ahead. This is next on the list.
Yeah, this is the EDP P18.
Yes.
I know, I'm sure everybody has been getting these. I've got them from our facility also, and how we're actually going to tackle this and get these completed. I'm not sure, Vina, what was Dr. Schuette's position on this. I don't know if you had more input from her. Did you talk to her?
Yes. Dr. Schuette, are you on the line?
Yes, I just got, I'm on, I've been here, and I'm amazed at how much work goes into health immunizations and so forth, health clearances. And what it was is that I had gotten some questions from Vina from members of the consortium, and so I answered them, and I sent her an email. And I don't know if that was able to be sent out. The questions, I developed some answers to the questions, and then I had them run by Baudre Caraway, supervising NEC, to make sure they're accurate. And because it's a new regulation, and Lori Melby and the attorneys want to know what kind of problems everyone is having, or issues or questions, I ran it by Lori Melby, executive officer, and she ran it by the attorneys, so that we just keep everything consistent. And I don't know if you just want to read it, or you want me just to briefly go through the questions, and then if you have any others.
That would be awesome, Dr. Schuette. Thank you.
Oh, okay. And just to let you know, we are so grateful to everyone, our clinical liaisons and our program directors and the faculty and staff completing these documents. They were mandated by the California State Auditor's Office, and they're the ones who made the suggestions for the forms and the numbers that are needed, and the procedures to move forward, so that the BRN can get a better handle on clinical placements. So whenever the NECs and board approve or deny clinical placements, that there's data to support, okay, the approval or disapproval. And so it was a joint commission on the legislative audit that put the recommendation and request to the state auditor's office to do the audit of the NECs, and this is part of that audit. So anyways, so the first question was, our nursing programs to request a new EDP 18 form to be signed and completed by all program contracted clinical facilities. And what we're asking is that you are completing them for all the currently used facilities. And then as any new facilities, as you move forward with new facilities, that you get those approved. So if you have contracts, with some agencies or some clinical facilities that you're not using, at this time, you do not need to submit them. When you start using them, then that is the time to get them approved. And we are asking that you send these initial ones to us by December 11th, and just try your very best to get them into us. We will notify the state. They will have the names of all the schools, and we'll have the list of all the approved for each school. And then, and there'll be, I don't know if there'll be a percentage, because they may want to know currently what is the percentage of approvals that, clinical facilities that are approved for our schools at this time. And then they'll just be working on that for the next 6 months to try to get it up to 100%. And there could be changes. They may want other numbers in the future. And so we'll just, we tried to get what they needed, right away, so we don't have to make too many changes going forward. Okay, so it's problematic. Does anyone have any questions about this answer to question number 1? Okay, then for number 2,
Yes, Donna, sorry, this is Dina.
Hello, Dina.
Hi, how are you?
Okay.
Fantastic. So just a quick question in regards to, just for clarification. So you're saying that the contracts that we have now, we have to get those forms. That's understandable. And then as we get additional new placements, they have to complete the new form. The contracts that we currently have, they need to complete this new EDPP 18 form, and we turn it into you by December 11th, correct?
Well, some schools have 50 to 60 contracts, but they're only using 20 of those contracts at this time. So it's those that you currently have clinical placements. Those are the contract facilities where you need to have an EDP P18. Okay, so then if you start adding in those other contracted facilities, you start sending students to those facilities. That's when you go ahead and get them approved before the students start. So you don't do all 54 that you have, because we want to, if you're not sending students there, we don't want the numbers to go up, for clinical placements to be falsely elevated. We need to know what's the use of our clinical facilities and so forth. So it's not all the contracted, only those contract facilities where students are being placed, currently being placed. And so it would be now, and it would also be for spring 2021.
And then I don't know if you're going to get to this question or not, but the next question is, if we are not getting feedback from facilities, how many attempts are we, to make up until December 11th? I mean,
well, you can't go to that facility if you don't have it approved. And beginning December 11th, you need to have the new form filled out, completed, for that facility. So you'll probably be able to finish out fall semester, but going forward in January, you're going to have the new one completed. So if they're not willing to sign, then you can't send students there until that gets signed. And I'm hoping that it won't be a problem. And what you can do is work with your NEC and you can have that clinical facility liaison representative, call the NEC too, so you can work it out. You could always be on a conference call together to work it out. Okay.
Donna?
Yes.
Okay, go ahead. Donna, this is Diane Morey. I do have a question about that, and it is a general question for everyone here. I thought I had heard, and I believe it was in the at the CACN COADN meeting that with the executive officer spoke, and speaking about these specifically, that no school would be out of compliance if they did not meet the deadline of December 11th with the new forms. So I'm wondering if I misunderstood, but I was thinking that the existing EDP 18s would continue on until we could potentially obtain the newer form if we were having difficulties. So maybe I need some clarification on that because of what I had heard at that meeting.
Well, she did, Lori did say that, and let me know, first of all, for you, Dr. Maury, it's a little bit different for you
I
in
understand.
completing them, you know, because.
But that's why I was making it a general.
Yeah, and I appreciate that. I'm glad you know the difference for you in getting those completed. I will say that we're making so much progress in getting these completed. And so that's why we're just thinking that most people are going, but you do the very best that you can going forward, okay? And so right, we're not, the state, when we send it into the state, I mean, the regulation hasn't been changed yet, okay? And so but we're just trying to get everyone to work, you know, to get as many as they can get done. And so, you know, so you're working at it. And we'll just be talking with you. The NECs will be working individually with their program directors, you know, to see what kind of issues they're having. And we'll be working with them to get them approved, hopefully, well, as soon as possible, you know, and so forth. But you are not going to be put in area of non-compliance or anything like that if you don't get them switched over by December 11th. We want you just to do your very best and then just go forward. But before you start using these facilities, that you start getting these new ones, okay, completed. So just work with your NEC. If you're having trouble, and that NEC will work with you, and the NEC will keep Lori Melby updated so that she knows, you know, the problems that we're having, and so she can just work with the state auditors.
I have a question. So do all of the schools, I think, understand how, because I've completed all the ones that have come out to us, and I'm going to say it was very overwhelming and confusing when the forms first came out, but thank you, Tracy, for helping navigate through the forms and explaining it, because once the numbers were explained, I felt comfortable with it, and then I just saved the draft, and then I was able really to reuse that draft, because then I understood the numbers and what I was agreeing to as a clinical facility. So is that happening? Because I think you probably I know as a clinical facility, if you're just explaining what the form is and how you're getting the numbers, you are providing that draft form for them already, it'd be easier, because there was a draft form that was sent by the BRN, but it's so vague that it really didn't mean anything. So that's just a suggestion, because that helped a lot. And then after that, I was able just to go through them very quickly.
This is Diane Morey. What we actually did was we filled out the new forms based on the old forms as best as we could, because most of that content is the same. Where it is differ is that one last column of the annual clinical capacity per unit. And for that column specifically, what we did was actually put the calculation in there and said here, and we said to our facilities, please check this information, make sure this is valid, and change it as need be. But that seemed to be that estimated annual clinical capacity, and I think it should say per unit, correct?
Yes, per unit, yes.
So we actually, I mean, I asked Donna, I said, is this the right calculation? And then we actually put the calculation in there, because we didn't want the facility to say, well, what is this? You know, what is this calculation? We also tried to ask the facility, and some of them got on the phone with us and talked to us and said, oh, please have a one-on-one explanation and so forth, which, you know, we certainly are willing to do to facilitate as best we can. We actually even put, for some facilities, it into a DocuSign so they could just, you know, look at it and sign it too, to kind of facilitate. So that was a couple of things that we were doing.
And does everybody on the phone understand, at least the clinical sites, what that last column means, estimated annual?
It's on that unit, that specific unit, how many students can they hold, you know, for a year?
Including,
you know,
all the schools, not just the one school.
Right, including all the schools. So I look at it as like the days and shifts currently available. Well, Yes, so if they're only available Tuesday, Wednesday, but they have to look to see, can students come 7 days a week and twice a day for days and evenings? So that's 14. Oh, let's see, 7 times 2, 14. And then how many students can be on that unit? You know, 2 or 3 or however many, and then we're talking 14, so times 14. And then you have to look at how many weeks of the year can these students come on, to the hospital, to the clinical facility, and then you multiply that in, and then that's your estimated annual clinical capacity. And so I anticipate that they're going to be adding numbers together so that for each program to make sure it doesn't come up to that total, it doesn't surpass that total number. However, anytime the numbers that we get when we look to approve a school, we check the numbers on the computer, on the table, how many spaces are available, and it goes over, we will be calling the program, and then they'll be talking with their clinical facility liaison to update that number or to make a change, on it. So it's just to keep a better track on for clinical placements so that we can approve them better or deny them. But so it's going to be a work in progress. We're going to be spending a lot of time on clinical placements until we get it working well and get all the numbers worked out. It's going to take some time on everybody's part. And I'm so sorry about it. And we tried to get all this information from the California Department of Public Health so we could just use their database, but the state auditor said that the BRN had to have their own numbers. And so it's put, and Lori Melby said that she did talk with all the directors of hospitals and the American Hospital Association, try to explain, everything to them, for it. So hopefully, does that explain how you get that calculation in that last column? It's kind of bizarre.
Can you go over that again, Don?
Oh, sure. So, if you want to pull it up, okay, so what you do is how many shifts a week, like the days and shifts currently available. And so you have to figure that out. Now this one here would say 2, but really it's not. These are just what's currently available for this school. But if you have 7 days, okay, 7 days in a week, and students can come all 7 days, and they can come day and evenings, okay, then that's going to be 14 in there. Okay, then you take the number of students that are allowed on the unit times the days and shifts. So if you have 4, then times 14. And then you're going to go over to, and so that's actually per week. But then you have to figure out how many weeks out of the year are you going to allow students to come. You generally, so you can decide. Some schools have it 52 all year round, because but some just take off Christmas, the holidays around in December, and so you multiply by the number of weeks in the year that you allow students to come, and then that's your number. So it's the number of students by the number of days and shifts per week, and then times the number of weeks per year the students can be in that facility, and then that's the number. And it can get up there. It can get up there to 2,000, 3,000. It just depends, upon the facility. And it can be small too. Some only allow 2 students a week, and they only allow 30 weeks a year. So so that's that number. And anytime you submit this to your NEC, the NEC will look at it, and if it doesn't look right, we'll call you. And then the individuals who are putting all the data in, and all those who are making all the analysis, they'll be talking to us too to see if there's, if we have to tweak something, So we're going to be working on it until we get the procedure truly established and get it into the, we have it in the computer and we're generating our data.
So if it's year round, that means it could go up to like 2,900, right?
Oh, yes.
Okay. All right. I didn't know our numbers would be extreme, but okay, that's good to know. Yeah. Thank you, Donna.
Oh, sure. Okay, so.
Donna, we have a question in the chat box from Loma Linda VA, Dr. Sofia Puerto. She is asking, does the form need to reflect what we can accommodate during regular time or during the COVID crisis?
I would do it during the regular times. Okay, during the regular time. So we have those numbers. We know what your placement is, your numbers of students are. And then, and so then we also know that during COVID, we're not there, for it. So that's fine. Now, if you want to, there are some facilities that don't want to complete them at all during this time, not until they come back. But then you're going to have so many whenever you start having everyone come back. So we're filling them out, and we're just stating that should COVID improve, they will be back. And so, so then they're mostly all the places are completing them now, even if they're not allowing students in because of COVID, because we're not really sure when students might be able to come back. We're very, very hopeful, although some have said it won't be till next fall, but if things get better, they may move it up, but the facility has the right to make the decision how they want to go forward with this. If they want to hold on it, that's fine. And then the program director will just make sure the NEC is aware that this is on hold due to COVID. And so, and that is fine.
Okay.
We can ask tell the facilities that they can use historical data then, correct?
Yes.
Okay.
Oh, yes. What they, so they don't want to lose what they have already, all those relationships that they have. Okay, so, and,
see a comment in the chat.
Okay.
Sorry, Donna. I just see a comment from Dr. Koseha from Eisenhower Medical Center. She's making a comment that the form is difficult or challenging to complete sometimes because a lot of their units are opening and closing kind of simultaneously, so they can't really keep track of.
So I would just, well, they, let's see, so that's Vicki. She can talk with Wayne Boyer, the NEC, out there. He probably, but also it could be, I don't think any of my schools have that facility, but you can fill it out to accommodate you. If it's going to be easier to fill it out what's there, but the caveat will be with the program director, and the program director will notify the NEC that this is dependent on COVID, that this is our usual plan with this hospital. Okay, this is in proper times. We certainly asked the state if we could delay till after COVID because of all the, and you see how they are with laws and regulations. They're staying, and you have to get a waiver and things like that. So we just have to do the very best. So I think it would be better, but you get to make the decision, just to fill it out as to what is usual. And then the caveat will, in the letter to the program director, who will tell the NEC that it is COVID. So this is on hold right now. Or we're not, we're waiting, but this is what our situation is, so that we know that this is where this group will come. And then the NEC, if the state decides that they don't want us to add those in yet, those numbers, they will be held in a, in an area, in a file. And then once, the COVID or something is done, then they'll be added, but maybe not. So, but it's okay to submit them. I have one that submitted, I have a program that submitted one for spring, but it's COVID and not sure, it's a day-by-day decision, but I signed it off and I sent it forward. So, I haven't heard back. It's been a week that I did something wrong on it. So hopefully that answers your question, Vicki, that you get to decide, okay, if you want to, but it is fine to include what your usual is for this school. Okay, and sign it off and get it in there for your hospital and for that school.
Hey Donna, this is Angie Gegeling from Cal State San Bernardino. I apologize if you've already answered this question, but it seems to me the form is only for hospital facilities. Are we also going to do this for places that we're using now, such as food banks and telehealth and things of that nature?
If the students are getting clinical hours, for a course that's required for licensure, then the form needs to be completed. So for all non-acute facilities, if the students are getting clinical hours, it needs to be completed. If they're going on volunteer, if they're a volunteer, that's different. You don't have to get that. But but they usually have to have, if you give credit for volunteer hours, you have to have, you know, a procedure and so forth, and what they need to do for that to qualify for any volunteer hours for clinical hours. And of course objectives have to be able to be met by the experience. But any place that the student is going in, a food bank, a after school program for students, and so forth, that there must be an EDP P18 if they are getting clinical hours in a course that's required for licensure. And that's on the EDP P06, the courses. Now, some schools do not have their public health courses, okay, and those clinicals, those 90-hour, that requires for the 90 hours, they do not have them as content required for licensure. And so when they are not listed as content required for licensure, you do not need to have EDP P18s for those courses. But if it is a course required for licensure, you must have an EDP 18 and you must follow 1427, the regulation. And that regulation, and I have it linked in this handout, and it, you know, it says that you must have objectives, you know, and it must meet the course objectives. You have to have this, you know, the all the role responsibilities of the staff and of the faculty and so forth spelled, you know, completely out and so forth. So you have to meet those requirements.
Yeah, some of these food banks and or other, you know, places where we have students, sometimes they're, you know, they're not big facilities. They don't require a contract. They don't have a contract. They have no legal team to risk management to look into contracts. How is that going to affect that contract statement there, and how do they know, or do they guesstimate the number of people that come into the food bank, and how is that handled in terms of the numbers?
They get the estimate. What is their usual number? They know the number of meals that they're providing and so forth. And they generally have, so you get the numbers from the clinical facility, you know, the agency, the service that you need to complete that document. And there was one other thing that you said about that. Oh, you should, you know, work with your, you know, remember with, I know what it was, in COVID, the state of emergency, you don't have to have a contract, but you do need to have a memo of understanding, a MOU, and you have to work with your NEC to get that opportunity approved so that it can count for clinical hours. So you need to keep your NEC approved, and you do need the EDP P18. Okay. And for your food bank, is it for a clinical course for licensure, or is it for public? I guess it would be for public health. So it is for a clinical course. So you would need to have an EDP 18, and then you would have to work with your NEC about whether you don't have a contract. You know, so unless they can do a contract with you, that the students. But this is something that you should work with your NEC on. You know, for. Does that answer it?
Yeah, we're working, and I have Dr. Boyer too, and he explains that there are a lot of questions and not necessarily, you know, answered for everything.
Well, yes, and you know, and you have to decide: are you using this kind of like as a volunteer experience? You know, that you're taking a faculty member in there with the students. So that could be, the way you describe it could be something different, so that a contract may not need to be, you know, established. But this is something that I would just stay in touch. I mean, this could be a question that I can just make sure Lori's aware, you know, of too, about you can't get contracts all the time. You know, with these individuals, but they do need to sign the EDP P18, and you need to have the objectives, and it may have to be described as a volunteer activity. You know, it's and it's not a healthcare facility. It's a non-health facility. But you have to make sure that clinical objectives can be met by that experience. Okay. These are hard questions.
Thank you, Donna. Let's see here. I'm not sure if you answered the question for how many times we have to notify the clinical facilities before, like if they don't respond, let's say, for example, do we try 3 times or do we have?
Well, I think I would work with your NEC. Okay. We don't have a firm date when the new ones have to be confirmed over. So you have your old approval, EDP 18, to carry you over until you can get that. And I mean, you have to try to find out, wonder what the reason is. I mean, is somebody going with students currently to that facility? Could a faculty member or, could they go in and talk to that person? If they're there in the hospital or the place, so they could talk and try to understand why it's not being completed, or is it because of COVID and they're not having anybody come yet? So that one's just going to have to be placed on hold until the students can come back. So I would just work with, keep your NEC apprised as what kind of problems you're having and so forth. So it can get worked out with time. So, but you do need to try to figure out why they're not answering the question. They may have a hard time figuring out how to complete it. And so they, so maybe a video conference may need to be held or something like that with them so that you can talk with them. And you never know, maybe that person's sick and isn't there. There's somebody else in their place. So you have to find out, wonder why they're not completing it for you, and then work from there. And I would keep your NEC aware so that person can work with you too on it. I had a couple that I had to work with one of my schools.
Okay, great. So I'm gonna, I think, so for this question, I think that was number 3. I did send the file with the BRN answers to this EDP form there. But if you guys have more questions, please let us know, put it in the chat box. I don't know if you wanted to go over question number 2, or did we answer that already?
No, we didn't do number 2. Well, in a way we did. There's a couple things on this one that are important to note, and you'll probably fall out of your chair. But anyways, because I was surprised when the state required this, the auditors. So do nursing programs need to update EDP 18 for facilities that are currently not able to be used or not being used at this time? And you do not. So you'll just put them on hold and so forth, okay? And I will tell you that we will work with you. There's no, we have to keep just improving to getting our EDP 18s, these new ones, completed. So we just need to be showing progress. I mean, the state has different ideas that you will by this date, but we need to work, we need to find out what all the problems are. And then it says, look at this next thing is, the BRN has asked for all programs to notify the BRN within 90 days of any changes in clinical placements, including the cancellation of a clinical rotation via the submission of a new EDP AT, and refer to, and it's in the Director's Handbook, Section 5, and it's 4.0, Clinical Facility Approval Instructions. So anytime you add a rotation, you need to update your EDP P18. Anytime there's it's canceled, there's a cancellation form. And so if it changes, our goal is to try to get these numbers to be accurate. And I saw where Sophia had written that these numbers may not be accurate. And so that's why we're hoping that we'll keep working on it. Our goal is to get them to get a workable plan so that we have an idea about our clinical placements. So that's going to be something that you need to start thinking about. Anytime there's a change that you have we're asking that within 90 days. And I think the state wants that to go into regulation, but it's not in regulation yet. And then the BRN has also requested to provide annual verification of clinical placements. Okay, so the program's NEC will forward each year the current BRN report of faculty to the program director, okay, for verification. And all you will do is that just like what we do for continuing approval visits, you will write C for cancel, you know, or remove, an R for remove, and you'll just have to have, you know, let us know how it is. So you're going to go through your list once a year to make sure it's accurate. Okay, and then if there's any changes, then we have to decide if a new EDP 18 needs to be completed or if there can just be an adjustment made, you know, on it. So, so once a year, so that we try to not let it get too far away from us. Once a year, we're going to be verifying if you still need to have these EDP P18s, if they're still current, or if you need to make some changes on them. Okay, so that's something that's new. And we're hoping that that will help, and then that will help to make things go smoother so that we will get better numbers. And then question number, any questions on number 2?
I don't see any.
And so it's going to be a full-time job with keeping up on these EDP 18s until we get it established. Okay.
Yeah.
And then question number 3. Yes, is there a question?
Yes, I put it in the chat box. Can you clarify the changes? Would we include the changes due to COVID?
Yes, however, our first time we're going to be sending this BRN report at clinical facilities won't be till next December. Okay, so we're not doing it yet. Okay, so now I did send, I know, and it's nice to hear your voice, Priscilla. Priscilla, her school is one of my schools, and so a form did go out to my programs, and I had them update their list, get rid of anything they're not using now. Okay, and so you're not going to fill another one of these out till next year, and so so you can decide if those students aren't going. You do not need at this time to develop an EDP. A new EDP P18. However, once you start going back, you need to have one. Now, the program and you can talk, you and the clinical liaison can talk if you want to have it completed and have it on file. And because we don't know when, you know, it's going to, COVID's going to be over, when you're going to be able to start. So if they want to submit it now, sign it off, but it's just on hold because of COVID, we will make note of that at the BR, you know, the BRN, you know, for that. But technically, because there's so many to do, only those that you are currently, you know, going to, those are the ones that you need to, we want you to have the EDP P18s completed. And then as you start resuming those places to get the new EDP P18 completed. So just keep working on doing that. Does that answer your question?
Yes,
Priscilla?
thank you.
Okay.
Awesome, thank you.
And so then for 3A, question 3A, do non-acute, non-clinical facilities such as senior centers, after-school programs, tutoring for children, child development centers, community service, food distribution centers, churches, and so forth, require an EDP P18 form? And it's yes, an updated EDP is required for all agencies and facilities being used by the program. And so you, and I have here this one, I don't think we can go to it, but it has the requirements that's there, requirements for clinical facilities. And so you can just go to that 1427. Oh, I do have the number up there, 1427. And you can see the requirements for each clinical facility. But remember, for the state of emergency, we don't have to have a contract, but you do have to have a MOU. And you'll work with your NEC in developing that, you know, with the facility. So just sometimes it's just a statement that the students are, it's a letter that the students are coming, and they will come with the faculty, and then if there's an RN there, that they will use those individuals as a non-faculty. And then there's requirements for the BRN. If you have someone as a non-faculty, they have to have 1 year experience working there, and they have to have an RN license, and you have to you maintain those. And then and so then you spell out in this letter just what the responsibilities of the facility is, and then what's the responsibility of the faculty. Okay, and so then you could just sign it off and you could use that as your MOU, for it. Now, some schools require a full contract. So you have to work with, with what your school requires. Now, number B is technically non-acute, non-clinical facilities do not have nursing staff, and many of them do not require a clinical instructor on site with the students for the entire time. So those are the facilities that would not require an EDP 18 form. Correct. And the answer is an EDP P18 is required for all agencies and facilities. And this answer here was actually designed by Lori Melby. Okay, so just to let you know from our executive officer, consistent with CCR section 1420E, clinical practice means the planned learning experiences designed for students to apply nursing knowledge and skills to meet course objectives in a variety of board-approved clinical settings. Consistent with CCR section 1427 clinical facilities, each such program shall maintain written agreements with such facilities, and such agreements shall include the following: a specification of the responsibilities and authority of the facility staff as related to the program and to the educational experience of the students, and a description of the responsibilities of faculty assigned to the facility utilized by the program. And then, in absence of facility RN, a non-faculty, it is the course clinical faculty who ensure that course clinical objectives are met by the students during the clinical experience to prepare students to safely and competently provide nursing care that requires a substantial amount of scientific knowledge and technical skills. And so with this, what Lori Melby is saying is that there needs to be a faculty with these students, if there is not a non-faculty there, and so forth. And this is something that you can talk about with your NEC to work make sure you get this workable for your program. But the students should be doing something. I know I have a program that they're going into a food bank, okay, but they have objectives, and there are other nurse practitioners there at that food bank who are checking children, pediatric nurse practitioners and so forth. And so, there is a faculty member there, with them, but of course they could use those NPs as a non-faculty too. But this is something that you should talk about and make sure that how you're conducting the experience for students to get clinical hours for a course required for licensure, okay, can get those out, can get those hours. So, that was something that she wanted to make sure that I just reinforced with everyone. So you have to be able to meet course objectives, and usually a faculty member or an RN there, a non-faculty, ensures that that the quality of the experience is such that the students will attain those objectives. Okay, and I think, is that the last one? I think, is that A or B? That was B. Let's see.
Yeah, that was B. So I think we're all good with that. I did send it again to the chat box. I'll reply back to everybody in an email, and we can send that as well with the sample. We'll have this meeting is being recorded, so we'll have it available on our YouTube and our IHEC website from now on. We'll be doing that, so you guys can also refer back to it that way. And I'll also send you the links for that as soon as we have the recording downloaded. We do have 2 additional questions, Dr. Schutte.
Okay.
So the first question is, since there is not an option for community health under content areas supported, do we need to include community health facilities even if they are just for community service or non-nursing related, tutoring kids with homework, distributing meals to seniors? I know we had a conversation about it, but just for everybody else on the Zoom call here, so that they are aware of what the answer is to that question. So, I mean, even in...
Oh, sorry. Go ahead.
Oh, yes, no problem. Go ahead.
Oh, no, that's all right. I'll wait, Vina, for you to finish. I'm sorry.
Okay, no problem. No, I have the sample on the screen here. And so just so that everybody has a visual, content areas supported, as you can see, there's not a section to check off for community health, but I'm wondering if it's a community health, do we just check off beginning med surge? And then, yeah.
Okay, well, there's a couple things with this question. You know, community service, you know, that's, are you giving credit for clinical hours for community service? You know, if you are, there has to be a way for that community service to meet the objectives of the course, and possibly a paper or something like that needs to be established, or there has to be some documentation that course clinical objectives were met. So this is something you can work with the assigned NEC to make sure what you're doing is okay. So community service is different. You know, if they're going on their own, you don't need an EDP P18, okay, for that. If they're going on their own, and then you're deciding if you're going to give them some credit, clinical hour credit, but of course it must meet the course objectives for that course, okay? Now, if you are going into an agency for a course, okay, now, if the course is called a community health course, so you will have to look on your EDP P05A. This is your total curriculum plan, and you're going to have to look at that to see how do you have that course marked. Do you have it marked as PEDS, Med Surg, or, you know, or what, okay? You can also look at the objectives that you're trying to get for these students, and you can decide, okay, because we don't have community health here, then you can, usually has to correlate with your EDP 05A, okay, and usually you have it as, you know, it could be blank, and so that you have the option. So for this experience, if they're going in for a PEDS, to get some PEDS hours or something, then it would be a PEDS for a community health course. If it's an OB, then you would put it for OB. If it's just basic health, adult health, then you could do a med surg, either depending upon the level of the student, if it's fundamentals, or if it's intermediate, or, you know, advanced. Okay, so you kind of look to see what course objectives are you meeting by this experience. Okay, and so that course, okay, and, you know, it should have a content area assigned, but if it doesn't, because it's community health, you have to pick the best one, what population is being served with that group, and then you can fill it out to address, you know, that area. You know, for adult, it would be med surg. So hopefully you just do the best you can. Now, what you can do is you can also talk with your NEC, you know, to help you to determine what's the best way to complete that, you know, to complete it, you know, in that case. Okay. Tutoring kids would be a PEDS, okay? But of course, and you're getting credit for, I don't know what course you're getting credit for this community service. Okay, is it for PEDS? Is it for a community health course? You know, and so forth. So you have to look at those things, okay, for the course, and what the objectives are, and what content area they would relate best to. And just do your best, but you can verify with your NEC.
Okay. Thank you, Donna. And then the final question is, what is the difference between checking a non-acute and non-health care? I know that some people, like, they want to, if it's like an ambulatory care clinic, do they check mark clinic and ambulatory care? If it's hospice, is it just, you know, ambulatory, I'm sorry, not ambulatory care, but just non-acute?
What I've been telling a lot of my program directors is, okay, whenever you go down to the clinical facility information, okay, if these are acute inpatient settings, for sure you're going to want to click acute, okay, if you're inpatient. If it's a clinic, okay, now if this facility, that, you know, it's one facility, they also have clinics, okay, and you also have clinics listed under the clinical facility information, then you're also going to do non-acute. So it depends upon your clinical experiences that you have down below as to what you can fill out here. Now, we haven't gotten any more specific guidelines yet from the BRN, on this. But for me, and the other NECs from the South, because we talk about these, okay, so we're saying that non-acute is like a clinic. It can be an outpatient surgery clinic, and so forth. It can even be a long-term care facility, so just choose your best, make your best. Really, if you say clinic and ambulatory care, they're both actually the same, but some facilities call them ambulatory care centers and others call them clinics. So if they call themselves a clinic, you could put clinic, or if they put themselves ambulatory care. Now, what we do, you can mark both too. I mean, you have some leeway there. Now, non-health care would be your community health experiences, like your food banks and things like that. Those are non-health care. So you could just mark that for the community. But, and you can mark telehealth if you're doing telehealth. If you have telehealth down here under clinical facility information, okay? But if you don't have any telehealth marked there, then you don't have to mark telehealth. So what you have down below should kind of go with up here. So whenever we have to record, okay, a facility, we look at your clinical facility information, and if you have inpatients, we make sure acute is checked. If you have telehealth, we make sure telehealth is, and we record it on a separate form that we have that telehealth is there. And then if there's clinics in there, we could do both non-acute, clinic, and ambulatory care, all three of those, on it. So I have a feeling in the future, as the people who input all the data have difficulty, okay, they're probably going to streamline this, and then we'll go from there. So just do your very best. And for me, it's easier for some of my program directors, just whatever clinical facility information has, that they use these up here. They don't go by what the facility, everything the facility has, only what they're using at that facility. Okay,
Right.
so, so we'll work with you. That's not a die place. What we're just trying to get the numbers for estimated annual clinical capacity, if it's med surg in the different areas, content areas. Okay.
I assume that if it is a non-healthcare facility where it says average RN staffing, average daily census, could they just put NA for not applicable?
Yes. Or you could put, yes, you could say, yes, you could put NA or 0.
Or 0.
In that one. Yeah.
Hey, Donna, this is Angie again from Cal State San Bernardino. Wouldn't it just be more effective or efficient if the BRN just asked each hospitals the capacity for annual capacity for each of the units of their hospital? So like say labor and delivery, if they have 8 per census or whatever, and they have an estimated annual of 150, like wouldn't you have that information already and just give it to all of us? And so we could just put it all on our forms? Because you're like, what if you have, let's say for instance, I have labor and delivery for XYZ hospital is 150, and then and then another school will say, well, it's 30, or another school will say 180. Like it's all varying numbers. Like, couldn't we just like say, hey, at hospital X, provide us with all the numbers of estimated annual clinical capacity for all your units where you have students? And so wouldn't that be more of an efficient way to get that information, instead of having all of these forms from different schools that the coordinator would have to fill out for each and every school that goes to these? We all go to their labor and delivery, we all go to the postpartum. I'm just wondering if we can provide feedback to whoever's making the decisions in these forms. Couldn't that be forwarded as a feedback? Ask the hospitals, they should know their average RN staffing, they should know their average daily census, they should know their estimated annual clinical capacity, and then just put that all on the form.
Oh.
And
And so, we're not having to give you different numbers, which will be kind of meaningless.
Okay, well, actually, remember the estimated annual clinical capacity is for nursing students, okay? So they don't have that. And believe me, Lori, the California Department of Public Health, can we use your computers to get this information from? This is just so much to ask of our clinical liaisons, our program directors, and also during COVID. Everybody is so busy, and it's not. So this annual, they don't have the number of students. They don't have that information. Now they have the average daily census, but they still won't give that, to us. And so the state wanted the BRN to be self-sufficient. They are required to have this by themselves. And that's what we're having to develop. And so, so believe me, Lori, I was there in a meeting when she sent the first email off to DCA, to the state auditors, and to California Department of Public Health, asking them for the numbers, if that we could just get those numbers from them. And I witnessed it, and it didn't go. It was no. So but the only thing we could get is the average daily, and it's published average hospital census, but they want the daily census for each of the units, and so forth. But the California Department of Public Health has that. So I will make sure, I will let Lori know that, there's great support for getting that information, for information from, other sources. So it's not so difficult, for our clinical liaisons and our program directors to get that information. But remember though, that the number of students on the unit and the estimated annual clinical capacity per unit is actually the number of nursing students that can be held on that unit. So, they don't have that number. So, but I certainly will take your suggestion to Lori and let her know. And we have, and I would say you can email me any questions, but really the way the BRN works, you work with your NEC, so just let your NECs know, and if they have a problem, they won't have a problem with this. The South NECs won't have any problems, with your questions, because we're learning too, and we want to know what the issues are so we can make things better, and we're here to support you. And so, please, I appreciate your feedback, Angie.
Angie and Donna, I just wanted to update you. We had an LA Region Coalition meeting on Monday, and this came up, obviously, clinical placements and these forms. And a lot of the schools and we're talking about the same issue. Mary Dickow was actually, the plan was to have, we were going to wait until the end of the week to hear back from her, but she was going to contact the BRN to find out if we could get one form filled out from each facility, and then we would attach it so it's the same, and we would attach it to our clinical facility EDPP 18 form. So that was what was discussed at that meeting. I just wanted to update you because there's just been a lot of problems trying to get this information.
Yeah, that's actually why I had placed the EDP 18 as an agenda item to this, to today, because I wanted to help out the clinical partners, because I think it only makes sense, if we're all going to say, let's just say Kaiser, Fontana, and they have an ICU. I mean, it should, the staffing estimate and the annual average census estimate should not change from school to school to school to school. And
Right.
so if like their liaison sends us, Consortium sends us the form and says, hey, IEHE Consortium, here are the numbers, go fill out the form. That relieves a lot of people in terms of like finding out and highlighting, like I'm having to highlight the different parts of the form that they need to fill out. And it's coming back to me saying, I don't know how to calculate this. I don't know how to figure this out. This changes. we do not have a 4 tower anymore. That's now a COVID patient. There's no students there. You know what I mean? So I just feel like it will make it more efficient and make it more user friendly if we say, okay, then just send us these information, we'll fill out the rest. And then we can send it to all of us. And you know, and we all know where we go in terms of like, do you go to OB or L&D, or do you go to postpartum and ICU and ER, so that we could fill out, you know, the number of students that we place there per their policy, per the capacity of the hospital. And so I just felt like there was, you know, like that's how I put this on the agenda, so that once we fill out the form, once they give us the numbers, we fill out the form, we send it back to them for signature, just to validate that we have the correct information there, about we do all the work, because, you know, they're inundated with COVID. We are too, but, you know, they're going to have to fill out, like, I'm guessing at least 20 forms for the different schools, you know, and having the back and forth, this is wrong, this is not accurate, you didn't calculate this right. I think it's just going to be so much more work than if we just say, okay, like what LA is doing. So I think people are finding out ways, or looking for ways, to make it more user friendly, to make it more amenable to our schedules that it's already overloaded, you know, to come up with a way to not inundate our clinical partners, because they should be, you know, doing what they're supposed to be doing in the hospital for COVID patients or their other patients. Thank you.
Well,
This is Diane.
Diane.
This is Diane Morey. One of the things is that I do remember the executive officer talking about at the COADN, CACN meeting, was the ability to work together, if possible, to have some of these collective forms filled out. And so I actually was at the LA meeting as well on Monday, and that, as mentioned already, that we did discuss that. So the idea was to see if a facility can fill out those components per unit, knowing how many students can be there, all of those columns, and then knowing what to do for that calculation for that last column, and seeing if that would be amenable and how that would look. You know, it was very general, the conversation originally, when the executive officer talked about it at the meeting. So we were trying to see, and that's what Mary Dickow was going to try to talk with the executive officer and say, if we do this, is this acceptable? So just some added conversation that I remember from the meeting.
And just so you know, one specific way to do it has not been developed by the BRN. However, we have received some documents from different schools who went together, and those were accepted. And I had two different kinds, okay, two different ways it was done. One of them was the hospital had all the information from the clinical facility, okay, information for each of their units, you know, all their areas where they have students already filled out, okay, and then that got attached, okay, to the back, and then the program director filled out the first, you know, the top sections, you know, of this, and then the clinical liaison and the program director signed the second page and completed the second page. Okay, so that one document, you know, developed by the clinical facility could be used, you know, by all of the clinical facilities. And there might be some schools here that might be in that group, but I don't have them, you know, as I think like UCI has done that. You know, they have one form and they're going to be attaching it to the back, and then they just sign, you know, sign off on the second page, but the program director fills out the first. Now, another one I saw, it listed the names of the schools. It came from the school. The letter came from the school. These are the schools that, you know, have clinical placements here. Okay, and then they have the information listed. Okay, so they included all the names. Okay, and then they attached that letter to the back of this, that they did sign the EDPP 18. So that's one way to prevent, you know, it being done so many times, that you have one form that has the information on, and then but you still Yeah, but I will say you need to, you do need to list what units your students are on, okay? And the number of the students on the units. So I would say, for the schools, because the blanket letters from the hospitals just have, when, what's all together available. So we kind of want to, well, I guess we could use this information here, but I am seeing that the program directors are filling out these 3 for their program. Okay, how many of their students are on those units, and then the days and the shifts, that are, are available where they're there. They're putting that in there. Now, we certainly have asked the BRN for some direction in developing, a procedure, but nothing has come out yet, on it. I think Miriam sent an email. Miriam McCarthy sent an email out to some of her program directors that this could be a way, but she did say to them that you can work together. And I do know that Lori Melby said that at that meeting, that you can work together on completing them. So as long as we get the information, that's important. And that's what's necessary, that we have the information on those. And yes.
This is Diane Maury again. I think the idea from the conversation on Monday, and certainly what we've talked about here, is trying to say, can we come up with a template that the hospitals could utilize, that we could all each attach to our EDP 18s, but make sure before we go down that route, which is what Mary Dickow was planning on doing, is this acceptable? So just to have some clarification in terms of the intent that came out of that meeting.
Well, I'm sure that if you want to submit one to see if it's workable, I would submit it to your NEC to see if it's workable.
Okay.
For it, I would think that it would be. And believe me, I can certainly ask, I'm happy that Mary is notifying Lori, because then that's another person asking, but I certainly will let her know too, that the development of that form, is strongly supported, for it. So go ahead, if you want to develop one, but just to let you know, I've already approved 2 in which it was the information here, the clinical facility information that was provided, and that was enough, but they did sign the form, and the program director completed that too. So, but if you want to submit one, that would be fine, and I could send it to Lori Melby and ask her to approve it. I have not been told yet if there's going to be if there's one in the making right now. I know we certainly ask, and we can get a team together to develop it, but I don't know. It just hasn't happened yet, and I think she wants. I think the goal is to have what's going to be workable for the clinical liaisons to do something that will be helpful to them. They usually can figure out how to develop it to make it workable for them, but they certainly can develop a template too about what they have off, what's available at each of their clinics and inpatient units, and that can be stapled to the back of the form, and then you just have to sign off the forms, and the program director is to complete these upwards ones. Does that sound workable, Diane?
Yes, it does. I was just thinking it would be nice to have one. And I understand there could be some variations, but maybe with instructions and so forth. And certainly we as the schools can explain these things to the facilities, but it just would be nice if it was a concerted collaborative effort and using one form. That was kind of the thought of it.
And I think what it was, she didn't want to be too prescriptive. I think she wanted the hospitals to be able to develop what they wanted to do to get the, to have that information, like what they did the last time, whenever the form was revised and they had to put more information in, for it. But I certainly will give you feedback, and you certainly can work together with your, with a facility that has a lot of students to see if you want to come up with something, and you can run it by your NEC to see if it will be acceptable. Okay, until we
Thank
get
you.
more information. Okay, thank you.
Thank you so much, Donna. I know we're running out of time here.
Okay.
Be prompt and end at 11, but if there are no other questions in the chat box or anything else that you want to say, Dr. Schutte,
No, that's all. Just work with your NECs because they want to make this better for you and for your clinical liaisons. Certainly.
okay. Thank you so much. I mean, I'm glad that you're here with us today, Dr. Schutte, because apparently we have a lot more questions than just those 3 questions, right?
Yeah. And I'll take those questions back. I'll take those questions back to the BRN.
Yes, that would be wonderful. Angie, I don't know if Angie and Jonathan are still here, but I know she wanted to talk about Skills Lab, but I don't know if we have enough time. Shall we table that for next meeting? Or unless there's any pressing updates about COVID as well? Anything from the team?
So I think for the Skills Lab, it's just a matter of asking if we're still conducting Skills Lab during COVID, because I think the issue is, you know, a lot of us are pretty much not allowed to be on campus, but then there's also that expectation that before we take our students to the hospitals that they have practiced and performed, you know, validated their skills in the lab. So I just want to see around here a round table of what people are doing, and if that is an acceptable practice at the hospital.
I know at CBU we still have our skill lab open. We maintain distance, they have their face shields and everything, but they are still doing skills and being validated in the skills lab.
At
Yeah,
APU, they're also doing skills lab and checking off the students who are in their first semester before they go into the hospital. They're getting checked off in person.
That's Cal State Fullerton as well for that fundamentals. They are in the skills lab, and all of those same basic skills are practiced and checked off before they have the capacity to be in hospital.
The same with West Coast.
All right. If you have not already, please put your first name, last name in the chat box for the attendance. I check it at the beginning and then at the end, but I'll also be saving the chat box text message. And again, this video is recorded, so I'll be sending everybody a link. Thank you very much for putting in your information there, thanks. I almost forgot, I know some people came in a little bit later, so. All right, was that your only question, Angie, on that?
Yeah, so I think it's safe to say that everybody's still conducting skills practice and skills validation prior to going to the hospital. Thank you.
Awesome. All right. And I know Dessa had to step away. Jonathan, I saw your screen was off, so I kind of took over. But any updates for COVID-19 or a roundtable from the facilities? And we'll be wrapping it up here shortly. Thank you, everyone. Or questions about COVID? I think we hashed it all out with the COVID stuff last meeting, but I know that CBU, we have our COVID attestation form now, and we do have COVID education through the World Health Organization website. So, I mean, things are changing as we move along. I don't know what the vaccine's what that's gonna look like for our schools and for the facilities. But I think that's pretty much it. Any updates from the facilities for roundtable? I hear crickets.
I think we're coming up on our time here.
Okay, anything in the chat box? Everyone is good? All right. Well, thank you everyone for your time. We are adjourning now at 10:59. I'll be saving everything in the chat box. Please be on the lookout for an email from me. If you are not on my email list and you want to become a member, please put your email in the chat box. I'll save that as well. But meeting adjourned. Have a great day. We'll see you guys. Our next meeting is January 21st, Thursday,
Bye.
11 a.m. same time on this link, this Zoom link.